If you're feeling overwhelmed by your emotions, or if you find yourself struggling to control them, there's a good chance you have a borderline personality disorder, BPD. In this video, we'll take a look at some of the most common signs that you might have BPD, and what you can do to get help. 1. Intense fear of being abandoned. People with borderline personality disorder, BPD, often experience intense fear of abandonment. This fear can make it difficult for them to form relationships, and it can lead to a lot of distress. People with BPD often have a difficult time regulating their emotions. They may become angry very quickly, or they may feel overwhelmed by feelings of sadness or anger. If you are concerned that someone you know might have BPD, talk to them about it. You can also seek help from a therapist or counselor. If you are experiencing symptoms of BPD, there is help available. Treatment can help you manage your fear of abandonment and improve your quality of life. 2. Unstable and often intense relationships. People with borderline personality disorder, BPD, often have unstable and often intense relationships. They may be very emotional and react quickly to changes in their environment or in the people around them. Relationships are one of the key areas that can cause problems for people with BPD. They may feel like they cannot control what happens in their relationships, and they may become very angry and intense when things do not go the way that they want them to. People with BPD often have a difficult time communicating their feelings. They may struggle to understand why things are happening in their relationships, and they may resort to using anger and blame to try to control the situation. If you are dating or have been dating someone who has BPD, it is important to be understanding and patient. It can be difficult for them to communicate their feelings, and it can take a lot of time for them to understand what is going on in a relationship. Patience is key. 3. Poorly developed sense of self. People with borderline personality disorder, BPD, often have a poorly developed sense of self. This means that they don't feel like they are good enough as they are, and they often struggle to make healthy and lasting relationships. People with BPD often have problems regulating their emotions. They may be very impulsive and reckless, and they may have a hard time understanding or accepting feelings of anger, sadness, and jealousy. If you are worried that you may have BPD, it is important to talk to your doctor. They can help you evaluate whether or not you have the condition, and they can provide you with resources to help you cope with your symptoms. 4. Impulsive behavior. Borderline personality disorder, BPD, is a mental illness that is characterized by recurrent and persistent difficulties in relationships, self-image, and behavior. People with BPD often have intense and unstable emotions, which can make them difficult to get along with. They may also be prone to episodes of impulsiveness and aggressiveness. People with BPD may act impulsively because they feel overwhelmed by their emotions. They may lash out at others or do something reckless in an attempt to escape from the feelings of anxiety and fear that are central to their disorder. People with BPD often struggle to control their impulses, which can lead to problems in their personal and professional lives. They may make impulsive decisions that could devastate their relationships or jeopardize their careers. 5. Self-harm and suicidal thoughts. Borderline personality disorder, BPD, is a serious mental health condition that affects approximately 1.5% of the population. People with BPD often have problems with self-esteem, identity, and relationships. Self-harm and suicidal thoughts are common signs of BPD. People with BPD may harm themselves intentionally or unintentionally. They may injure themselves physically or emotionally. They may also think about harming themselves frequently. If you are worried about someone you know with BDP, don't hesitate to reach out for help. There are many resources available to help people with BPD manage their symptoms. 6. Emotional instability. Borderline personality disorder, BPD, is a psychiatric disorder characterized by intense and unstable emotions, impulsive behavior, and recurrent relationship difficulties. People with BPD often have trouble regulating their emotions and often experience intense and unstable moods. They may also engage in risky behaviors, such as substance abuse, to cope with their emotional distress. If you are concerned that you or someone you know may have BPD, talk to your doctor or mental health professionals. They can help you identify the signs and symptoms of BPD, and they can provide treatment options. 7. Anxiety bordering on paranoia in social situations. Borderline personality disorder, BPD, is a mental illness that is characterized by intense and unstable emotions, impulsive actions, and unstable relationships. One of the most common signs of BPD is anxiety bordering on paranoia in social situations. This means that you may become extremely anxious and fearful in social interactions. This anxiety can make it difficult to form relationships or to feel comfortable around other people. You may also feel like you are under constant scrutiny, which can lead to feelings of isolation and loneliness. If you are experiencing these symptoms, please do not hesitate to seek help from a doctor or therapist. They can help you to manage your anxiety and improve your overall well-being. 8. Substance abuse. Substance abuse is a broad term that refers to any persistent use of drugs or alcohol that causes social, psychological, or physical problems. People with BPD are particularly prone to alcohol and drug abuse. They may use drugs and alcohol to self-medicate or to escape from the feelings of anxiety and depression that are characteristic of the disorder. Substance abuse can lead to serious health problems, such as liver damage, addiction, and withdrawal symptoms. It can also lead to criminal behavior, such as theft or violence.